Hello, you are most welcome, ladies and gentlemen, to the Understanding Spirit of Anatomy on Tuesday Night Anatomy with Daniel Okwan. On today's section, we want to look at a quick revision on the skull osteology that we've already looked at. And I'm going to do this with you through some MCQs that I've set out. I'm going to help you get the correct answers, and those which are wrong, yes, we justify why they are incorrect. So without much ado, let's quickly run through this. And we begin with question number 1. And question number 1 says, which of the following is false? Option A, the skull consists of 8 cranial bones, all unpaired except 2, and 14 facial bones, all paired except 2. Now, this is a very true statement. Yes, the reason is that, yes, we know the skull consists of 22 bones. And out of these 22 bones, they are organized into 2 groups. Those which are going to, house an important component of the nervous system, being the brain. And that one will be the cranial bones, because developmentally, it will come from what we call the neurocranium. Okay. And then we are also going to have the remaining 14, from what we call the facial bones, which of course developmental will be coming from, of course, the visceral cranium. Because at the end of the day, important is to talk about the eye, the oral structures, nasal structures, yes, will be housed there. So this is a very true statement. We will get to know that all of them, yes, if you take the cranial bones, they will be unpaired except 2 of them, which I'll be making mention to you. And then if you look at the facial bones, yes, all will be paired except 2 of them. Now, option B says the anterior fontanelle, which is triangular shaped and could be utilized to access the superior sagittal sinus, fuses around 18 to 24 months of extrauterine life. Now, this statement, is incorrect entirely, because what happens is that, yes, the anterior fontanelle will fuse around 18 to 24 months of extrauterine life, no problem. Yes, we can use it to access the superior sagittal sinus, in fetal life, so that, of course, in medially natal life, so that, yes, various analysis on the blood could be done. But what happens is that it is not triangular shape, but rather it is diamond shape. The triangular shape one is the posterior fontanelle. So this is a wrong statement. Now, option C says usually the frontal bones are connected by the metopic suture up to 8 years postpartum, although in about 8% of the population it could persist. Now, that's a very true statement. Yes, of course, in fetal life, yes, and then immediately postpartum up to age 8, what happens is that, yes, the frontal bones will be made up of 2 bones, connected at what we call the metopic suture. But post 8 years, if it persists, then that becomes a persistent, metopic suture, which we find it in about 8% of the population. So that statement is also a true statement. Now, option D says the frontal bone forms the anterior wall of the cranial cavity, floor of the cranial cavity, and roof of the orbit or the orbital cavity. Now, that's a very true statement. Now we get to know that, yes, if we look at the anterior wall of the cranial cavity, yes, it will be formed entirely by the frontal bone. If you look at, of course, the roof of the cranial cavity, the anterior aspect of the roof, yes, will be contributed by, of course, the frontal bone partly. Now, if we are contributing to the roof, now look here. Yes, the roof, yes, very good, and then it will contribute to what we call the roof of the orbital cavity. That's a very true statement, because what happens is that apart from forming the roof of the orbital cavity, it will also contribute to the floor of the cranial cavity. If you are contributing to the floor of the cranial cavity, then indirectly you are contributing to, of course, the roof of the orbital cavity. You look at those kind of things. So this is a true statement. Now, option E says the supraorbital foramen allows for the transmission of supraorbital, nerve and vessels. This is also a true statement. So you get to know that, yes, you have a supraorbital foramen, which, of course, if it fails to fuse completely to become a foramen, it becomes a notch, and it will allow for the transmission of supraorbital, nerve and vessels. So you see those ones. So regarding this question, yes, the correct answer we are going to get from it is option B. Which of the following is false? So trying to justify what we have, yes, I told you that yes, we talk about the skull, we're going to have that of the cranial bones, and then of course we have the facial bones. And if you look at it now, there's a lateral view. If you look at this lateral view, you get to know that now if you talk about the cranial bones, okay, those ones which are going to developmental come from the neurocranium, we are saying that all of them will be unpaired, okay, except two. So if we talk about the unpaired ones, yes, this one that you see here at the front aspect of the brain, sorry, of the body, of the head, that is the frontal bone. So frontal bone is unpaired. So there we are. If you take the lateral view, that's the frontal bone. And then we also have another bone at the rear aspect of the head, that is the occipital bone. Okay, that's also unpaired. It's a single bone. Now, other bones which are unpaired will include, now this portion we'll look at it later, that's the greater wind of the sphenoid bone. Now, there's the sphenoid. The sphenoid is also unpaired bone, as well as of course the ethmoid. Okay, so ethmoid having this perpendicular plate, you see that. So ethmoid, sphenoid, yes, the frontal bone and the occipital bones are the unpaired bones of the cranium. And then if you look at the paired bones, there are two. Okay, only two are paired, and that is the parietal bone, yes, which is forming actually most of the roof as well as lateral wall of what we call the cranial cavity. So that's the parietal bone. And then of course we also have what we call the temporal bone, the temporal bone. So that is what you have to know about the cranial bones. There are 8 bones. Okay, all of them unpaired except 2, and the 2 which are paired are the parietal bone and of course the temporal bone. And then those ones for the facial bones, we are saying that all of them are paired except 2. So if you look at the facial bones, yes, you are going to see, yes, this is what we call the 2 nasal bones, okay, on either side. Okay, that is where the bridges of the pedicles tends to rest. Okay, so these are the 2 nasal bones. And apart from that, we have the 2 lacrimal bones, okay, at the medial wall of the nasal, the orbital cavity. You look at that. So the lacrimal bones are also there. They are also paired. Then of course, we also have some kind of structures which are in the nasal cavity, okay, and those ones, the inferiormost one are separate bones. We call it inferior nasal conchae. Inferior nasal conchae. They are also there. Then of course we have the 2 maxillary bones. These are the maxillary bones. The 2 maxillary bones are there. Then of course the 2 zygomatic bones, the cheekbones. Okay, the 2 zygomatic bones are also there. Okay, so these bones represent bones, okay, which are going to be paired. Okay, they are the paired bones of the skull. Now for the unpaired bones, we said there are 2. And they are going to be found in the midline. Yes, the largest one being of course this U-shaped bone, being the mandible, the lower jaw bone, and then of course another portion which forms part of the nasal septum, the inferior portion, which we call it vomer. So these are the bones which form the facial bones. All of them are paired except 2, vomer and of course mandible. So that is what I want you to know here. Now, looking at the fontanelles, now remember that another name for fontanelles is soft spot. Okay, so soft spot. Now, in various views, as you can see over here. Now, if you look at this lateral view, okay, we can see, of course, these lateral fontanelles, anterolateral and posterolateral fontanelles. If you look at the superior view, now let me start here. Let me just use this one as to show you. Now here I'm having the anterior fontanelle, Now this anterior fontanelle, you can see that it is diamond shaped. Okay, as you can also see here, it's diamond shaped. So what happens is that usually we expect that it fuses around 18 to about 24 months postpartum. Okay, so usually roughly 2 years it gets fused. Okay, so this is the anterior fontanelle. It is diamond shaped and not triangular shaped. So, but one thing that you have to know is that what bones or what sutures are contributing to this anterior fontanelle. So you get to see that, yes, we are going to have the 2 frontal bones, which will be connected by, of course, the metopes suture, okay, being related to it, as well as, of course, the 2 parietal bones, okay, relating to it, which will be, yes, also related to, of course, the sagittal suture. We will see these things later. Okay, so these are the relations that you have to know. Then if you look at the posterior fontanelle, okay, so if I take a posterior view, there's another fontanelle. This time around it is triangular shaped. It is triangular shaped. And this one, yes, because it is smaller compared to the anterior fontanelle, this one fuses earlier. Okay, so it fuses, yes, around 2 to about 3 months, okay, of postnatal life. That's when it fuses. Okay, and that one, yes, we see that it's related to, of course, the occipital bone and, of course, the two parietal bones, yes, with, of course, the lambda, okay, and, of course, the lambdoid, suture, and, of course, the sagittal sutures, relating to it. So now then we have, if I take this lateral view, then I'm going to have the anterolateral fontanelle and I'm going to have the posterolateral fontanelle. But if you see it, if you look at it closely, then you get to know that, yes, the anterolateral fontanelle is a bit smaller than the posterolateral fontanelle. And that is why, yes, the anterolateral fontanelle, yes, roughly 3 to about 6, maximum 6 months time, it gets fused. But the posterolateral fontanelle, yes, up to about 6 months, that is when it gets, fused. So what we will see is that the anterolateral fontanelle, yes, will become something, yes, which will become, yes, the anterolateral fontanelle, because it's related to, an important portion, that's the, the greater ring of the sphenoid bone, okay, we call it the sphenoidal fontanelle or the sphenoid fontanelle. And then the, the posterolateral fontanelle, because it's related to the mastoid process of the temporal bone, we also call it, mastoid fontanelle. Okay, so that is what these anterolateral and posterolateral fontanelles, they're actually irregular shaped, unlike, the anterior fontanelle, which is diamond shaped, and the posterior fontanelle, which is, triangular shaped. Okay, but importantly, what happens is that these soft spots or these fontanelles, although we are calling them soft spots, they're actually strong enough. They're actually strong membranous, structures over there. Okay, so they are not just soft, so to speak, but we are using the term soft spot to represent them, because at the end of the day, with time, when they get fused, they become other structures. So for instance, the anterior fontanelle becomes something we call bregma, the posterior fontanelle we call lambda, and of course, the anterolateral fontanelle will be called what we call terion, and then of course the posterolateral fontanelle being asterion. So we see all these things. Now remember that importantly, these fontanelles, okay, will help, in, of course, molding of the head as it goes through the birth canal. Okay, so during delivery, yes, the fontanelle helps to, mold the head and eventually come out. Then of course, in shaping the head postnatal life, yes, by, compressing the head using some hot, water and what have you, then what happens is that it helps, mold the shape of the head. Okay, so these are important bits that you have to know. And then of course, for, increasing size of the brain so that it can accommodate it, okay, importantly. But one thing is that if these fontanelles fuse earlier, then it leads to what we call cranial stenosis, okay, and that is not, very good enough, resulting in, a very small, skull. And of course, development of the brain will also be hindered, leading to, of course, increased intracranial, pressure. But importantly, one other thing is that, there is this large sinus, one of the duodenal sinuses, which is known as superior sagittal sinus, because of course it's in the superior position and it runs in the sagittal plane. And what happens is that through the anterior fontanelle, yes, venous blood could be taken from, the neonates for various analysis. But importantly, get to know that the brain is a very delicate, organ. Therefore, we don't really play with it when you talk about, aspirating or sampling blood using the superior sagittal sinus. Okay, and that's what I want you to know. Now, I also told you that, yes, the two frontal bones, yes, in fetal life they were two, and they will be connected by what we call the metopic suture. Yeah, the metopic suture will persist, yes, usually as one gets delivered and air begins to blow over this suture, then it begins to, fuse. Up to about age 8, then it gets completely fused. Okay, but if it persists, then that is when we talk about, the persistent metopic suture, which we find it in about 8% of the population. So that is what I want you to know. But I also told you that if you look at the cranial cavity, yes, the anterior wall, yes, as you can see, if the brain is there, the anterior wall will be bounded, okay, by what you call the frontal bone, okay, as well as of course the superior portion of the roof of what we call the cranial cavity, and that's the superior wall. Okay, then we also see that yes, there will be that kind of foramen. Now look here on the frontal bone, as you move from, now there's a squamous part, okay, as you descend, okay, anteriorly and of course inferiorly, then what happens is that you meet what we call the glabella, okay. There's that kind of projection over here we call glabella. We will see those ones. And then of course if I get to the nation, okay, I'll show you the nation later. And then of course take a lateral course, okay, then there's this thickening over here. It thickens over here, the frontal bone thickens, so that we form what we call the supraorbital margin. And this supraorbital margin, yes, will bear what we call supraorbital notch or foramen. That's a notch. Now you have the foramen, and within the foramen, that is where the supraorbital nerve and vessels will be running through it. Okay, so it means that this is a notch because it failed to completely form the foramen. You will see other things later. So when the two frontal bones fuse completely and there's no Hypoficial suture, that is what we see. Okay, and as part of the frontal bone, we are going to see that kind of frontal eminence. Okay, so there's that kind of projections over there, which we call them frontal eminences. We have some in other bones too. Okay, so this is frontal eminence. Now above the supraorbital margin, okay, that thickened form, yes, you have the area where we have the superciliary arch. Okay, superciliary arch, where of course the eyebrow will tend to grow over here. Okay, so these are the few areas that we want you to know. Yes, I told you that the supraorbital margin will be interrupted almost at the midline, the middle point, by what we call a supraorbital foramen. If it fails to completely fuse, it becomes supraorbital notch. Now I also told you about the glabella. Okay, so these are the things that I want you to know. Now I told you again that if apart from the frontal bone forming, yes, the anterior aspect of the cranial cavity, anterior wall, also contributing to the floor of the cranial cavity, also contributing to part of the roof of the cranial cavity. Apart from thickening to form what this supraorbital margin, the orbital margin over here, then it moves posteriorly to form part of the wall of this orbit. Okay, so the wall of this orbit or this orbital cavity, yes, its roof will be contributed mainly by this frontal bone, and that becomes the orbital process or the orbital plate of what we call the frontal bone. So that is what I want you to know. So let's go to question number 2, and question number 2 says, which of the following is not true about the pterion? Then it says A, it is H-shaped and represent the weakest area of the skull. Yes, we get to know that the pterion will be H-shaped, then represent the weakest area of the skull. That's a very true statement. Option B says it represents the site of anterolateral fontanelle in fetal life and neonatal life. Yes, that's what we saw. Yes, we realized that yes, the anterolateral fontanelle, also called the sphenoidal fontanelle, yes, will be eventually give rise to this pterion. Option C says the bones that contribute to its formation are the frontal bone, lesser ring or sphenoid, temporal bone, and the parietal bone. Now this is partly incorrect. The reason is that yes, no problem, that it is contributed by actually 4 bones, and these 4 bones are, yes, we have the frontal bone is there, no problem. The temporal bone is there, yes, no problem. The parietal bone is there. The only problem is that yes, although the sphenoidal bone is there, the only problem is that it's not contributed by the lesser wing or sphenoid, but rather the greater wing or sphenoid. So there's a wrong statement. Now option D says it is related to the middle meningeal artery, hence fracture at this point could result in intracranial hemorrhage. Now there's a very true statement. Okay, we will look at that, other details of it. Now, option E says posterior to the pterion is the asterion the site of mastoid soft spot. Now, this is also a very true statement. Okay, so the posterolateral fontanelle is going to give rise to the asterion. Okay, that is the site where originally we are having the mastoid soft spot. I told that the soft spots are also known as fontanelles. So by way of justifying what we've seen, then what we are saying is that if you look at this area, which is the weakest part of the skull, okay, lateral, if you take a lateral view, okay, this is the pterion. This is the pterion. Now I told you that the pterion represents the anterolateral fontanelle. Anterolateral fontanelle. And so you can see that the bones which are contributing to it, yes, part of the squamous, lateral part of the squamous aspect of the frontal bone is contributing to it. Yes, the parietal bone is also contributing to it, as you can see. You also have the squamous part of the temporal bone also contributing to it. Then this portion of the sphenoid bone, this is not the lesser wing or sphenoid, this is the greater wing of the sphenoid, greater wing of the sphenoid. But one other thing too that we find is that, yes, deep to this, this is the external view. So if I cut and open it, then deep to this, pterion, you will see an important blood vessel, and that blood vessel is known as the middle meningeal artery, okay, which is a branch of the maxillary artery. So the middle meningeal artery, okay, will also be related to this pterion. But importantly, more specifically, so in an exam which they want you to tell them specifically, it has to do with the anterior branch of the middle meningeal artery. The middle meningeal artery will give off two branches, will give a parietal branch or the posterior branch, and to give a frontal branch or the anterior branch. It is the anterior branch which is related to this middle meningeal artery. Therefore, fracture to this pterion may result in intracranial hemorrhage. Blood will seep in there. Okay, so that is what I want you to know. Now, posterior to it. Now, get to see this. So you realize that this pterion over here, okay, will be related to, of course, this suture, which you call it the coronal suture, okay, to be related to it. Then apart from that, it will also be related to, of course, the squamosal suture, okay, it will be related to it, okay, this way. Okay, so that is what I want you to know, to be related to it. All right, so this is what we call the pterion, the pterion. Now, posterior to the pterion, there will be another intersection point, which you call it the asterion. I already told you that the asterion will be related to the parietal bone. Yes, it will be related to the, of course, the mastoid process of what we call the temporal bone, as well as the occipital bone. Now let's go to question number 3, and question number 3 says, which of the following is not true about the cranial bones? Now option A says the calvarium, also called skull cap or cranial vault, is formed by the frontal bone, the bilateral parietal bones, and the occipital bone only. Yes, this is the calvarium, very important component, okay, forming actually the cap, so to speak, of what we call the brain. So that's a very true statement. We see that. Option B says the parietal bones contribute to majority of the roof and the lateral wall of the cranial cavity. This is a very true statement. You look at that. Option C says the parietal bones articulate with the frontal bone via the coronal suture, This is a very true statement. I'll show you. So that's the frontal parietal suture. That's called the coronal suture because it runs in the coronal plane. Option D says the parietal bones feature the parietal eminences and emissary foramina. Yes, that's a very true statement. I'll show you. And then option E says the entire parietal bone articulates with the occipital bone via the lambda. Now this is where the statement is wrong. Yes, indeed, the parietal bone, yes, obviously articulates with the occipital bone via that one will be in the midline via the lambda, but majority of it will be via, of course, the lambdoid suture. So that is what I want you to know. So there we are. Now this is the inferior view of the calvarium, and that's the skull cap. If you look at it, then anteriorly it will be formed by the frontal bone. Yes, on the lateral aspects, yes, we have the two parietal bones. That's why we say it is bilateral. And in the posterior aspect, we have what we call the occipital bone. So that is what I want you to know. Now, of course, if you look at the inferior aspect, you get to know that in the midline there will be a groove where, of course, the superior sagittal sinus will dwell. Okay, and then of course, if you look at the lateral aspect where we have the parietal bones, yes, you see the various branches of what we call the middle meningeal arteries. So the grooves for the various branches of the middle meningeal arteries will be related there. So that is what I want you to know. And then I also told you that in between the frontal bone and the two parietal bones, they will be separated by this suture, and this suture runs in the coronal plane. Okay, that's the frontal parietal suture known as coronal suture. Coronal suture. And then of course, if you have the two parietal bones, interparietal suture, because that suture is running in the midline, we also call it the sagittal suture. Okay, because of course in the midline we have the mid-sagittal plane. So the suture over there, okay, interparietal suture, will be called the sagittal suture. Then of course, if we take the two parietal bones, yes, separating it from what we call the occipital bone will be another suture, which we call it, the lambdoid suture. Lambdoid suture. That's why I told that the lambdoid suture will be the main articulating point between, of course, the two parietal bones and the occipital bone. The lambda, which of course was the posterior fontanelle, okay, is actually just in the midline, very small, contribution. Now, so I told you that yes, the parietal bone will be very important in forming majority of the roof of the cranial cavity, as well as contributing to the lateral wall of course, the cranial cavity. Although portion of the lateral wall will also be contributed by what we call the temporal bones. Okay, temporal bones. Okay, so these are the things that we want you to know. Yes, we've seen the suture, the front, the coronal suture, okay, between the frontal bones and the parietal bones. Then of course, between the parietal bone and the occipital bone, that is the lambdoid suture. And of course, between the parietal bone and of course the temporal bone will be the squamosal or the squamous suture. Okay, so these are the things that I want you to know. All right. Now, one other thing too that you have to know is that if you look at the parietal bone, apart from you saw that the frontal bone was having some kind of eminences, the parietal bones also have eminences. Okay, so on either side, these are the parietal eminences. Parietal eminences. And then I also told you that yes, if you look at it closely, you can see there are some small foramina over here. So one on either side. These are known as parietal foramina. And we can also call it emissary foramina because the parietal emissary veins, okay, also will run in here. So that is what you have to know. Now let's go to question number 4, and question number 4 says, which of the following is not true? Option A, the medial wall of the orbital cavity is contributed by the maxilla. Yes, that's a very true statement. I'll show you. Go through actually the wall, of this orbit that we're looking at. Option B says, while the inferior nasal conchae are separate bones of the face, that of the superior and middle nasal conchae are part of the ethmoid bone. Now remember, if you talk about the conchae, they are like ear-like structures over there, which you find them in the nasal cavity. They can also be called turbinate because they cause turbulence in the air, so that they can actually, after causing this swelling or turbulence, they can have enough surface area to actually, humidify or give warmth, or in other words, condition the inspired air. So in fact, what happens is that it is only the inferior nasal conchae, which are separate bones of the face. The other bones, which we call them superior and middle nasal conchae, are part of the ethmoidal bone. So we look at that. Option C says the ethmoid presents with a horizontal plate that is perforated for the transmission of the axons of the olfactory nerve. That's the cranial nerve 1. Yes, its axons will be running through the cribriform plate of the ethmoid. That's the horizontal plate over there. So it will be running through it, so that yes. So that's a very true statement. Option D says the nasal septum is formed by the vomer superiorly and the perpendicular plates of the ethmoid inferiorly, reinforced by the septal cartilage in the living. No problem that the nasal septum is formed by the vomer and the perpendicular plate of the ethmoid. By the positioning is that said that the superior portion of the nasal septum will be contributed by what we call the perpendicular plate of the ethmoid rather, and then the vomer will contribute to the inferior portion of it. Yes, no problem that in the living it will be reinforced, or of course it will be completed by what is called septal cartilage. That's a very true statement. Now option E says the ethmoid represents one of the bones that has paranasal sinuses. Yes, we see the paranasal sinuses. Yes, it's very true that the ethmoid is one of the bones which is having paranasal sinus. Yes, so let me take this opportunity to tell you about the boundaries of the orbital cavity. Okay, so if you look at the roof, you've already seen that the roof or the superior boundary of this orbit is going to be contributed mainly by, of course, the orbital plates of what we call the frontal bone. So mainly by the orbital plates of the frontal bone will be contributing to it. Then apart from that, a very small portion of what we call the sphenoid bone. Okay, that is the lesser wing of the sphenoid bone, contributing to, of course, the roof of it. So if you've seen the roof, then how about the floor? Okay, so if you look at the floor from lateral to medial, then we are going to say that the floor will be contributed by, of course, the zygomatic bone. Okay, zygomatic bone will be contributing to the floor. Then apart from that, of course, the maxilla. Okay, so maxilla will also be contributing to it. That's the orbital surface of the maxilla will be contributing to it. To, of course, the floor of the orbital cavity. Then apart from that, there also going to be another component which is at the rear aspect, posterior aspect of the floor, and that one is going to be the orbital process of the palatine bone. We will look at these things. So these are the three bones which are going to contribute to the floor of this orbital cavity. So you have to actually know the boundaries that contribute to the this orbit. Then apart from that, yes, let's look at the lateral wall of this orbit, the lateral wall. So lateral wall, yes, from superior to inferior. Then we are going to have, now you get to know that, yes, apart from the the frontal bone contributing to the roof, it also contribute partly to, of course, the lateral wall, and that portion is actually the zygomatic process of the frontal bone. Now get to know, you see that now this bone is the zygomatic bone, this is the frontal bone. Now that process which is articulating, that process of the frontal bone which is articulating with the zygomatic bone is going to be called the zygomatic process of the frontal bone. Although this bone is the frontal bone, yes, that process where it's articulating with the zygomatic bone will be called zygomatic process of the frontal bone. So that portion of the zygomatic bone which is also contributing to the frontal bone will be called the frontal process of the zygomatic bone. So this is how the nomenclature goes. Okay, so yes, so laterally it will be contributed by the zygomatic process of the frontal bone. Then apart from that, it will also be contributed by, of course, the greater wing of the sphenoid bone, greater wing of the sphenoid bone. Then of course it will also be contributed by, of course, the the zygomatic bone, actually the orbital surface of the zygomatic bone, contributing to the lateral wall of the orbital cavity. And then if you look at the medial wall, okay, so the medial wall, because now the medial wall we saw, now this is the optic canal. Once I see the optic canal, then I know the body of the sphenoid will be there. So the body of the sphenoid, okay, contribute to the medial wall. And then of course you also have the orbital plates of the ethmoid. We will see all these things, orbital plates of the ethmoid. Then of course, apart from that, we also have what we call the frontal process of the maxilla, and then finally by, of course, the lacrimal bone. Okay, so these are the bones which contribute to the boundaries of the orbit. You have to know those boundaries, and you have to also know the bones which contribute in the formation of the orbital boundaries. Okay, so it means that you can see that apart from the inferior boundary or the floor, okay, all other portions will be contributed by some portion of the sphenoid bone. So that if you look at the medial wall, yes, the body of the sphenoid is there. If you look at, of course, the roof, yes, the lesser wing of sphenoid. If you look at lateral wall, greater wing of the sphenoid bone. Please get to know these things. Now, I also told you that, yes, regarding, yes, I mean, there are three ceph-like. They are actually paired ceph-like bones, which you find in the nasal cavity. And these bones are known as the nasal conchae. They are ear-like, conchae, ear-like. But what happens is that you can also call them, yes, turbinates, okay, nasal turbinates. But what the important point here is that the superior and the middle nasal conchae, these two are actually part of the ethmoidal bone, actually part of the ethmoid. The inferior bones, okay, which is known as the inferior nasal conchae, are separate bones altogether, Okay, so that's what I want you to know. Now, in the living, they will be covered by mucous membranes so that they can help, wheel the air. They can help, cause turbulence in the air so that it can increase the surface area so that the air can be well conditioned and all that by way of giving it warmth and, of course, humidifying it. So there we are. If you look at the ethmoid bone is going to have this, cresta galli, okay, and then it's going to bear this horizontal plate which is perforated, okay, that's the cribriform plate, and these perforations will allow the axons of the olfactory nerve to run through it, okay. So that is what we see. But also perpendicularly, okay, to this horizontal plate will be this perpendicular plate of the ethmoid, and I told that this perpendicular plate will form the superior boundary of what we call the nasal septum. You will see that. And then we also said that, yes, it will have these air cells. These are the ethmoidal air cells. That's the ethmoidal sinus, okay, will be there. And then we saw that contributing the medial wall of the orbit was this orbital process, okay, of what we call the ethmoid. So there we are. If you look at it this way, if you look at superior view, looking at the base of the skull, you can see that this is the horizontal plate which is perforated. So that's the cribriform plate, the highlighted area over here, the cribriform plate of the ethmoid, so that the axons of the olfactory nerve, cranial nerve 1, can go through it. And of course the cresta galli will be here, cresta galli. So nasal septum, superiorly by the perpendicular plate of the ethmoid, inferiorly by the vomer. So number 4 over here is the perpendicular plate of the ethmoid, and then number 3 is the vomer, separate bone altogether. So by way of the paranasal sinuses, which I want to tell you something about it. Actually, paranasal sinuses, they are adjacent or near this nasal cavity, okay, that's why we call the paranasal sinuses, and they are actually, yes, areas which represent more or less like empty areas so that they can help lighten the skull, okay. So apart from lighten the skull, they also serve as resonating chambers of sound, okay. And one thing is that, yes, we are going to have 4 of them, and with the mnemonic MEFs, you can remember all of them. So M for maxillary sinus. So the maxillar bone or maxillary bone will have a sinus, so maxillary bone. And E for ethmoid, so ethmoidal air cells, okay, ethmoidal air cells will also have it, so that's the E. And F for frontal sinus, and then S for sphenoidal sinus. So simply with the mnemonic MEFs, you should be able to tell the bones which bear paranasal sinuses. So MEFs, M for maxillary, E for ethmoidal, F for frontal, and S for sphenoidal. Now let's go to question number 5, and question number 5 said, which of the following is not true? Option A says the temporal bone features the temporal lines for the attachment of temporaris, okay, temporaris, muscle and its fascia, okay, that's a very true statement. You see that. Option B says majority of the zygomatic arch is contributed by the temporal bone with little contribution from the zygomatic bone. Now, this is a very true statement. We will get to know. Although the name is called zygomatic arch, majority of the contribution is coming from the temporal bone. So you see that. Option C says the lacrimal bone bears the lacrimal sac containing fossa for collecting tears. This is also a very true statement. We look at all these things. In the medial wall of the orbit, you see the lacrimal bone and to bear lacrimal sac. You see that. Now option D says the infraorbital foramen is contained in the maxilla. This is a very true statement. We saw that the supraorbital foramen was in the frontal bone. Was in the frontal bone. You see that. Then option E said the hard palate is formed by both the maxilla and the palatine bone. This is also a very true statement. So within this question, in this question, there's no wrong statement. So let's try and justify it. Now, so if you look at the temporal bone, actually, if you take a lateral view, you see that there will be some prominent lines that you find over here. Especially, there are some people, when they remove every hair of theirs from the head, then what happens, they can actually appreciate these lines very well. Okay, the superior one will give attachment to the fascia of what we call the temporalis muscle, and the inferior one will give attachment to the fleshy muscle itself. Okay, so these lines, okay, are what we call the temporal lines. The superior one is called superior temporal line, then the lower one is called inferior temporal line. Okay, so that is what you see. And then one other thing too is that now this area, this thing that you find over here is called zygomatic arch. It's called zygomatic arch. Okay, and the zygomatic arch is contributed mainly by, now you can see this bone is the temporal bone, because over here you can see the sternal costimia, you can see the mastoid portion. This is the temporal bone, the bone over here. So this temporal bone, you can see that majority of it is contributing to this arch, with small contribution coming from this zygomatic bone, okay, the cheekbone. So this is the zygomatic arch. So we can say that the posterior two tears will be contributed by this portion of the temporal bone, which we call it the zygomatic process of the temporal bone, because that is articulating with the zygomatic bone. And this portion of it, the anterior 1/3 of it, is contributed by what you call the temporal process of the zygomatic bone. Okay, so although we are calling it zygomatic arch, most of the contribution is coming from the zygomatic process of the temporal bone, and that's what I want you to know. But now let me tell you something. Now these temporal lines, most students tend to confuse it. There's that kind of confusion with this suture, which we call the squamous suture. Okay, so this squamous suture, okay, you see that it appears like you've knitted certain things together. Okay, the temporal lines will not be like that. Okay, get to know that. Now I told you that in the medial wall of the of the orbit, you are going to find a bone, and that bone is known as the lacrimal bone or the tear bone. And over there, what happens is that now that within the same orbit, at the superlateral aspect of the orbit, that's where the gland, the lacrimal gland, will be located, the tear gland. And this tear gland, these are the main excretory ducts, so that the tears will flow from here and it will be on the eyeball, and then from the eyeball it will get into what we call the superior and inferior lacrimal ponta, and then of course into superior and inferior lacrimal canaliculi. Now from there it gets into what we call the lacrimal sac. So within the lacrimal bones we have what we call lacrimal fossa. Okay, and that fossa will bear a sac which is known as lacrimal sac. And that lacrimal sac, okay, will also take the tears into the nasal cavity via the nasal lacrimal duct. Okay, so you have to, understand this, mechanism over here. Now, so one thing too that I told you is that if you look at the maxilla, so there's the maxillary bone, okay, the upper jaw is over here. This maxilla will bear these foramina, the infraorbital foramina. We saw supraorbital foramen, okay, foramina on the frontal bone, so we'll get to know that. And then one other thing too is that now this whole portion is known as the hard palate. Over here is the hard palate. Now this is the anterior 2/3 portion of the hard palate, and this is the posterior 1/3 portion of the hard palate. Now the hard palate is therefore formed anteriorly by what you call the palatine process of the maxilla. Now you can see this is still the upper jaw, so this portion is part of the maxilla, So because the posterior bone over here is known as Palatine Bone, and therefore the process over here will be called Palatine process of the maxilla, because it's going to articulate with the Palatine Bone. Okay, please get to know that. So anterior, two-thirds of the hard palate contributed by the Palatine process of the maxilla, and the posterior, one-third will be contributed by, of course, the Palatine Bone. Actually, the horizontal plate of the Palatine Bone. Okay, please get to know this one. We will look at other things as the questions come up. Okay, but I think, let me tell you this now. You realize that there will be a suture, okay, in between the two the two upper jaw bones, and that's the maxilla, and that is what we call the median palatine suture. This whole thing is the median palatine suture, but that portion over here between the two maxillary bones will be called intermaxillary suture. Okay, but there will be another one between the two palatine bones posteriorly, and that will be an interpalatine suture. The whole suture between, yes, the palatine suture, intermaxillary suture and interpalatine suture will contribute to what we call the median palatine suture. And then again, separating, of course, the maxillary bone from, of course, the palatine bone will be what we call the transverse palatine suture. Transverse palatine suture. Okay, this whole thing, transverse palatine suture. Okay, and that is why, because they are meeting over here, there's that kind of cross formed over here, and therefore you can also cause these sutures the cruciate sutures. Cruciate, cross. You will see other things. Now let's go to question number 6, and question number 6 says, which of the following is not true? Option A says the temporal bone has a squamous part and a petrous part. Now this is a very true statement. You look at that. Option B says the internal acoustic meatus is found in the temporal squama. No, this is a very strong false statement. It is going to rather be housed in the petrous part of the temporal bone, not the squamous part. Option C says the pituitary gland dwells in the saddle-shaped sella turcica. Now this is a very true statement. You look at that. You look at it pretty soon. Now option D says the stylomastoid foramen allows for the passage of the facial nerve. This is a very true statement. You look at that. And then of course option E says the temporal bone bears the breast-shaped mastoid process and the rod-shaped styloid process. That's a very true statement. You get to know that the temporal bone will bear this mammillary shaped or the breast-shaped mastoid process, and of course the rod-shaped or the pen-shaped styloid process. You look at that. So by way of justifying it, now this whole bone is the unarticulated temporal bone. Okay, we've disarticulated it, and it consists of what we call a squamous part. Okay, that's the flat part. Now remember, all these bones of the cranium, we describe them as being flat bones, but there are some portions which are more flatter, and therefore use the term squama. So something like frontal squama, temporal squama, these things are terms that we are using. Occipital squama, that's the squamous part, the more flat portion of the bone over here, and within that flat portion of the bone we can see this process over here, which is going to articulate with, of course, the zygomatic bone, is therefore called zygomatic process of the temporal bone. Okay, that's what we are going to see, and within it there's going to be a meatus, that opening into the ear, and that's the external acoustic meatus. So the external acoustic meatus is portion which we are going to find at the inferior aspect of the temporal squama. Okay, over there. And then also we are going to have this breast-shaped process, which we call the mastoid process. Okay, being a bit posterior placed, and of course being a bit anterior placed will be what we call the styloid process. Styloid process. Now all these processes later on we get to know they are important areas where muscles will actually going to attach. Now in between, of course, the mastoid process and the the stylo process will be a foramen, which we call it the stylomastoid foramen, and that is where, of course, the facial nerve actually, yes, will be running through. Okay, stylomastoid foramen. Now you can see that at the rear aspect of the mastoid process, we are going to see another foramen known as mastoid foramen, for, of course, the mastoid emissary vein to actually run through it. Okay, now apart from the frontal the temporal squamous, we're also going to have what we call the hardest portion of the bone in the human body. Now remember that the hardest substance in the body, of course, is enamel, followed by, of course, dentin, then of course followed by cementum of the teeth, of the tooth. But what happens is that the hardest bone substance that you have in the body is known as the petrous part of the bone. Peter, upon which, of course, the rock, Jesus rock being the Peter, of course. So Peter is actually petrous part. That's the petrous, the hardest portion. Now take notice of this. We'll look at it later. It will bear what you call the carotid canal. It will also bear the jugular foramen. But apart from that, importantly, it will bear what we call the internal acoustic meatus. Internal acoustic meatus. We'll look at these things later. Okay. Now, if you look at this butterfly-shaped bone, this bone is actually, the sphenoid bone. It will bear, of course, the lesser wing, which is not shown here. But important, then, these are the greater wings that you find over here. Importantly, this one, I want you to show you this area, this saddle-shaped region, which you call a sella turcica. Now, this sella turcica will bear this area, which you call it the hypoficial fossa or the pituitary fossa. Of course, within it, the pituitary gland will actually come and dwell here. Now, anterior to this pituitary fossa will be what we call tuberculum celli. Anterior to pituitary fossa will be the tuberculum celli, and posterior to it will be the dorsum. Dorsum has to do with posterior. Will be, of course, the dorsum celli. Okay, and there will be other processes. Okay, anteriorly. Okay, we have what we call the anterior clinoid processes. Okay, over here. Anterior clinoid processes, and then posteriorly we are going to have the posterior clinoid processes. But anterior to this tuberculum celli will be a sulcus, where, of course, the optic chiasma will actually dwell, and that becomes the chiasmatic sulcus. So this is what I want to show you. So this area, this saddle-shaped area, represents what we call the sella turcica, and within it we are going to have the hypoficial fossa, where the pituitary gland will dwell. Now, importantly, I showed you that in the petrous part, now this is the hardest portion of the bone, okay, that we are going to see. We are going to have what you call the internal acoustic meatus. And internal acoustic meatus, as part of the contents of internal acoustic meatus, we are going to have cranial nerve 7, cranial nerve 8, as well as, of course, labyrinthine artery will be running through it. I don't need to tell you that facial, nerve, and then, of course, vestibulocochlear nerves are referred to as, cranial nerve 7 and cranial nerves 8, respectively. Please get to know that. Now let's go to question number 7, and question number 7 says, which of the following is false? Option A says the keystone bone of the skull is the butterfly-shaped sphenoid. Yes, we are calling it keystone bone because it's able to articulate with all bones of the cranium, okay, as well as some of the bones of, the facial bones. So that's the keystone bone. Now, option B says the lesser wing of sphenoid forms the boundary between the anterior and middle cranial fossae. Now, that's a very true statement. We'll look at that. Option C says, apart from bearing the optic canals, the optic canals will be located on the body of the sphenoid. Between the greater and lesser wings of sphenoid is the superior orbital fascia. We'll look at that. That's a very true statement. Option D says, the caudal portion of the greater wing of sphenoid bears 3 foramina, and these foramina are the foramen rotundum, foramen ovale, and foramen spinosum. Now, this is a very true statement. Look at that. You look at the contents as well. Then option E says the medial pterygoid plate, which ends in pterygoid hamulus, provides attachment to the medial pterygoid muscle. Now, bear in mind that the medial pterygoid plate, all these ones are projections which radiate inferiorly from the body of the sphenoid. Okay, we are going to have, the medial pterygoid plate and, of course, the lateral pterygoid plate. Both of them become what we call the pterygoid process. But bear in mind that the medial pterygoid plate will bear the pterygoid hamulus. No problem. But the attachment, the medial pterygoid plate doesn't provide attachment to any of the masticatory muscles. Now, this muscle is the medial pterygoid muscle, one of the masticatory muscles. Okay, so if you not watch those videos, please visit those videos so that you get more insight in this. Okay, it is only the lateral pterygoid plate which provides attachment to this. We look at that. So there we are. Now look at this bone that I'm highlighting over here, this region over here, this area. Okay, this butterfly shaped bone is known as the sphenoid. Okay, so the sphenoid, now look at it. Now if you look at this area, okay, anterior to this lesser wing of sphenoid represent what we call the anterior cranial fossa. Then posterior to this lesser wing of sphenoid is the middle cranial fossa. Therefore, this lesser wing of the sphenoid bone is therefore serving as the boundary between the anterior cranial fossa and the middle cranial fossa. Then, of course, the superior margin of this petrous part of the temporal bone forms, of course, the boundary between, of course, the middle cranial fossa and, of course, the posterior cranial fossa. So that's what I want you to know. Okay, of course, the bones which are going to dwell there. If you look at the anterior cranial fossa, look at some of the bones, mainly frontal bone, yes, will be there, both anterior and of course laterally. If you look at, of course, the middle cranial fossa, you can see, of course, the temporal bone contributing to it. Okay, as far as, of course, some portion of the parietal bones also being there. The, of course, posterior cranial fossa, mainly by, of course, the occipital bone with some contribution from the parietal bone. So that is what you have to know. So that's a very true statement, no problem with that. But what do you see now? You realize that in the body of, now this area is the body of the sphenoid. You can see some foramina over here, and these foramina are known as the optic canals. So optic canal will allow for the passage of cranial nerve 2, and that's the optic nerve, as well as, of course, the ophthalmic artery. Okay, it will be passing there. Then, of course, there's a fissure between, of course, the lesser wing of sphenoid and, of course, the greater wing of sphenoid. That fissure over here is known as the superior orbital fissure. Superior orbital fissure. Now, superior orbital fissure will allow for the passage of a lot of nerves. Okay, and they will include, of course, cranial nerve 3, cranial nerve 4, cranial nerve 6, and, of course, a portion of cranial nerve 5. So if I talk about cranial nerve 3, then I'm talking about the oculomotor nerve. Cranial nerve 4 being, of course, the trochlear nerve. Cranial nerve 6 being, of course, the abducens nerve. Then, of course, one of the division, the first division of the trigeminal nerve, that's cranial nerve 5, being the ophthalmic nerve, ophthalmic division, will be running through it. And even apart from that, there will be a superior ophthalmic vein also running through it. So these are the content that we are going to find over here. But I'm interested in showing you this, that in the inferior aspect, okay, running from medial to lateral, posteriorly, from anterior to posterior, from medial to lateral, we are going to have 3 foramina. And these 3 foramina, given the mnemonic ROS, you should be able to tell us. And R for rotundum, O for ovale, and S for spinosum. So ROS. Okay, and they are going to be found in the greater wing of the sphenoid. Okay, so rotundum, okay, so R, okay, for rotundum will be carrying the second division of what we call the trigeminal nerve. The first division, the ophthalmic division, came from the superior orbital fissure. Then the second division will be coming from the foramen rotundum. Okay, that's the maxillary division. Then we are also going to have the ovale. So for foramen ovale, yes, apart from going to transmit the third division, that's the mandibular nerve of the trigeminal nerve, it will also allow for the passage of some accessory meningeal artery, as well as something we call lesser petrosal nerve. Okay, we'll look at those things later. And then, of course, we have most posterolaterally placed, we have what we call the foramen spinosum. And foramen spinosum will allow for the passage of what we call the middle meningeal artery. We will look at that. Okay, so I will show you that apart from that, the meningeal branch of what we call the mandibular nerve may also pass through. Otherwise, sometimes this meningeal branch will also pass through this foramen ovale. Okay, so that is what I want you to know over here. So there we are in the foramen spinosum. You can see what we call the middle meningeal artery emerging, and then eventually dividing into, of course, the posterior branch and, of course, the anterior branch. So that's what I want you to know. Now, if you look at, take an inferior view, okay, of what we call the skull, you get to know that yes, the sphenoidal bone will be there, okay, and the sphenoidal bone will bear, okay, this. Now there's a vomer, okay, forming part of the nasal septum. Now the sphenoidal bone radiating inferior from the body, we are going to have these, plates. And so laterally will be called lateral pterygoid plates, and then medially will be called medial pterygoid plates. Medial pterygoid plate will end in what we call pterygoid hamulus. Now, in between the lateral and medial pterygoid plate will be a fossa, and that will be called pterygoid fossa. But I told you that the medial pterygoid plate would never provide attachment for any of the masticatory muscles. Now, rather, on the medial aspect of the lateral pterygoid plate will provide attachment to, of course, the medial pterygoid muscle, and the lateral aspect of the lateral pterygoid plate will provide attachment to, of course, the lateral pterygoid muscle. Okay, so please, that is what you have to know. Okay, so that is, that one. But remember, if I talk about pterygoid process, then I'm talking about the medial and lateral pterygoid plates. So medial and lateral pterygoid plates will form what we call the pterygoid process. Pterygoid process. Now, question number 8. Question number 8 says, which of the following is not true? Option A says the occipital bone features nuchal lines and the inion. That's a very true statement. You have superior and inferior nuchal lines. Even someday it could be a supreme or highest nuchal line, and the inion is actually the external occipital protuberance. You look at that. Of course, there will also be an internal occipital protuberance in the inner aspect. Option B says the basilar part, that's the base of the occipital bone, bears the foramen magnum, that's the largest foramen, bounded anterolaterally by the occipital condyles for articulating with the lateral masses of the atlas. So the lateral masses of the atlas will have articular surfaces which are actually concave superiorly, so that I can articulate with the convex shaped occipital condyles of the skull. Now, option C says the hypoglossal nerve is contained in the squamous part of the occipital bone. It's not going to be the squamous part, but it's going to be the basilar part, the base of it. And then option D says the posterior cranial fossa is contributed mainly by the occipital bone. We already seen it already. That's a very true statement. Option E says at the rear, that's the posterior aspect of the skull, within the sutures are occasional Wermian bones. Wermian bones are also known as sutural bones. I'll show you. So there we are. If you look at, this is the posterior view of the skull. So you can see the parietal bone being superiorly, and this bone is the occipital bone. That's why I'm interested in. The occipital bone will bear what we call an inferior nuchal line, and then of course a superior nuchal line. Now at the midpoint of the superior nuchal line, we have the inion. Okay, the inion, also known as external occipital protuberance. External occipital protuberance. And as of course superior to this, superior nuchal line, you may occasionally see this highest nuchal line or the supreme nuchal line. Okay, so this is what I want you to show you, okay, over here. Then of course the largest foramen in the skull, okay, is in the basilar part, and that is the foramen foramen magnum, magnum like mega, so very large. And of course over here, of course, the medulla oblongata will be meeting the spinal cord over here. And of course, some vertebral arteries will also be running alongside, as well as of course the spinal accessory nerve, okay, will also be exiting through this area, okay, as well as some anterior and of course posterior spinal arteries, okay. So we have those ones also around here. Of course, the meninges of the brain will also be around this area. Sorry, of the of course the medulla oblongata and of course the spinal cord will be related over here. So please, this is what I want you to know over here. Then of course these are the occipital condyles. You can see they are convex shaped, okay, inferiorly, and then superiorly, okay, we have lateral masses of the atlas, okay, bearing that kind of concave shaped articular processes for the articulation, so that we form what we call the atlanto-occipital joint, so that it can help in of course nodding. And of course that atlantoaxial joint, which of course later we look at, that one will help in shaking of the head, okay, that one is very true, or lateral rotation of the head and neck region. Now So please look at this one. If you look at this foramen magnum, okay, it's part of the basilar part, the base of it, not the squamous part. Okay, and laterally placed, anterolaterally placed, you have the hypoglossal, canal, and hypoglossal canal will admit the passage of or the exit of what we call hypoglossal, nerve. That's the cranial nerve 12. Cranial nerve 12. Of course, if you look at this portion, we said is going to form majority of the posterior cranial fossa. The occipital bone is going to form majority of the posterior cranial fossa, and of course, this area is mainly by the cerebellum will be here. Okay, importantly. Then of course you can see those kind of transverse sinuses. Okay, so this is it. And of course I told you that internally we are going to have internal occipital protuberance. So again, let me tell you something. Yes, we've seen that the posterior cranial fossa will be contributed mainly by, of course, the occipital bone. Yes, if you look at this area, the middle cranial fossa, yes, the temporal lobes, okay, will be there. Yes, the frontal lobes will be in the anterior cranial fossa, as we've discussed already. Now, very good. Now, at the rear aspect of the skull, within the sutures, so you can see within the sutures, there could be some bones. Now, these bones, usually they are not many, could be 2 or 3, but sometimes they could be as many as you can, but normally 2 or 3 will be there. We call them Wemian bones. Wemian bones. Also call them sutural bones because they are within sutures, or they develop within sutures. And these ones, they represent markers for diagnosing what we call brittle bone disease. Okay, brittle bone, that's the clinical significance over here. So that is what I want you to know. Question number 9 says, which of the following is not true? Now, option A says the largest paranasal sinus is seen in the maxilla. Now, that's a very true statement. I'll show you and compare the sizes again. Option B, the maxilla is the only bone of the skull that bears alveolar processes. That's not true. Once you are going to have teeth, then you will bear alveolar processes. Not only the maxilla will bear teeth, also the mandible will bear teeth. Okay, so we will see that. Option C said just posterior to the central incisive teeth is the central incisive canal or fossa. You will see that. I'll show you the canal and fossa or foramen. Now, option D, it is only during fetal life that the maxilla is paired. This is a wrong statement. So the maxilla will be paired throughout life. Option E says the anterior nasal spine is present on the maxilla along the median plane. Now, that is also a very true statement. Okay, so I'm going to justify these ones. So with respect to size of the sinuses, we saw that the mnemonic MEFs will help us know that. So the largest paranasal sinus actually is the maxilla, is the maxillary sinus, and of course it will be followed by, of course, the frontal sinus. Then of course to be followed by sphenoidal sinus, and of course the ethmoidal air sinuses will be the least with respect to size of these sinuses. Then once we are going to bear teeth, now we are going to have these processes which we call them alveolar processes. Alveolar processes. So we are going to find it both on the maxilla as well as on the mandible. Both on the maxilla as well as on the mandible. And then I'll show you once again, okay, a lateral view of it. We are going to have the anterior nasal spine. Anterior nasal spine. Okay, so let me show you something. If you look at this maxilla, for instance, we are going to see that there will be, let me show you this to show you some processes. There will be a process, this maxilla will articulating with the zygomatic bone. Therefore, this process will be called zygomatic process of the maxilla. You can also see that this maxilla is articulating with the frontal bone. Therefore, we call this one the frontal process of the maxilla. In the same way, this process will be called, of the frontal bone, will be called the maxillary process of the frontal bone. So that is how the nomenclature goes. Now, let me tell you something over here. Let me use this opportunity to explain this. Now, look at this. We have this internasal suture. Now, these are the nasal bones. Okay, left and right nasal bones. So there will be a suture in between them. We call it internasal suture. And then there will be another suture between, of course, the frontal bone and the nasal bone. So that will be frontonasal suture. At the point between the internasal suture and the frontonasal suture, anteriorly, this point is known as nasation. Nasation. Please get to know this. That is nasation. So nasation is the anterior intersection that we find between, of course, the internasal suture and the frontal nasal suture. Okay, please bear in mind. Please, with the sutures to rename them, apart from those traditional ones like sagittal suture, coronal suture, squamous suture, lambda and lambdoid, what happens is that the other sutures, you name them depend on the articulating bone. So for instance, this one is between, of course, the maxilla and the zygomatic bone. It will be called, zygomatico maxillary suture. Okay, so that's how you just combine the names. Okay, so in that manner. So for instance, if it is between the zygomatic bone and frontal bone, frontal zygomatic suture or zygomatico frontal suture, in that manner. So that is what I want to show you. Okay, that's what I want to show you. So if you look at the mandible to mandible, we also bear alveolar processes. We look at other features. Okay, now if we look at, these are the central incisive tooth. Okay, these are the lateral incisive teeth. Okay, so over here, just behind them, you have this fossa, which you call it incisive fossa, and this incisive fossa will bear the incisive foramen. Okay, there will be a foramen in it, and then that foramen will connect what we call the nasal cavity to, of course, the oral cavity. It's not going to just do that connection for anything, but it's going to help transmit what we call anterior palatine vessels as well as the nasal palatine nerves. Okay, and that is it. And this bone over here, this is one of the maxillary bones. This is another one. They are always paired. Okay, and they will be connected, they will be separated by the intermaxillary suture, which is portion of what we call the median palatine suture that we've seen. So I told you that we have the anterior nasal spine as part of what we call the maxilla. So anterior nasal spine will be found on the maxilla. Now question number 10, and that is our last question. And it says, which of the following is not true? Option A says the posterior nasal spine is contributed by the posterior portion of the hard palate. Now, this is a very true statement. We will get to know that yes, the posterior portion of the hard palate is a palatine bone, and that one will bear a posterior nasal spine. We look at that. Option B says the palatine bone bears both the greater and lesser palatine foramina. That's a very true statement. We look at that. Option C says the only movable bone of the skull is the U-shaped mandible, which consisted of two bones in fetal life. Now, this is a very true statement. Yes, so there was an intermandibular suture between them. Yes, and there was actually a fibrocartilaginous substance between them. That's a symphysis menti, which got fused. Now, remember that all the bones of the skull, okay, will actually be made up of will be connected by an immovable joint. That's the suture. Okay, with the exception of the mandible, which is the only movable bone. Okay, the rest are immovable. Now, option D says the head of the condyloid process, or the condyle or condylar process of maxilla, okay, articulate with the temporal bone at the submandibular fossa. Now, this is a very wrong statement. Yes, the condyloid process will be on the mandible and not the maxilla, and it will articulate with the temporal bone at the mandibular fossa. Not the submandibular fossa, is the mandibular fossa. I'll show you that. Now, option E says apart from the temporal bone featuring the carotid canal and jugular foramen on either side of the mental protuberance is the mental foramen. Yes, that's a very true statement. So we will actually be looking at all these things. Now, there we are. Now, if you look at this, you get to know that look at this. This is the hard palate. Now, the posterior aspect of the hard palate is contributed by the palatine bone, and the palatine bone will end in this, in the midline, in this posterior nasal spine. So it means that now these are the nasal bones. Okay, left and right nasal bones connected by the internasal suture. Now we said that, so it means that these nasal spines, by way of anterior nasal spine and posterior nasal spine, will have nothing to do with the nasal bone. Anterior nasal spine will be contributed by, of course, the maxillary bone. Posterior nasal spine by, of course, the palatine bone. The palatine bone will bear this horizontal plate. Okay, there's a horizontal plate of the palatine bone. Okay, and the horizontal plate of the palatine bone will bear two foramina, and anterior place will be the greater palatine foramen, and posterior place will be the lesser palatine foramen, and they will help in the transmission of what? Of course, greater palatine, and lesser palatine nerves, respectively. Okay, that's what they are going to actually transmit. Okay, so that is what you have to know around this point I want to tell you. Now, if you look at an inferior view of the skull, actually on the petrous part, now I told you that to look at it on the petrous part of the temporal bone, we are going to, apart from having the internal acoustic meatus, we are going to have at the anterior medial aspect, okay, of the petrous part of the temporal bone, we are going to have what you call the carotid canal, and then of course the posterior lateral aspect, we are going to have the jugular foramen, and of course we know that, of course, the carotid canal, okay, will be transmitting, of course, the internal carotid artery, and of course, the jugular foramen will be transmitting, of course, a lot of structures apart from internal jugular vein, also inferior petrosal sinus, glossopharyngeal nerve, that's the cranial nerve 9, even the vagus nerve, as well as, of course, spinal accessory nerve, that's cranial nerve 11, as well as, of course, posterior meningeal artery. So those ones will be transmitted over here, okay, in this. But of course, mainly, that the carotid canal, internal, carotid artery, at least you shouldn't forget that, the jugular, foramen will allow, of course, internal jugular vein, as well as, other structures, other nerves, notably cranial nerve 9, cranial nerve 10, and of course, cranial nerve 11 will be passing through it. Okay, so that is what I want to show you here. Now, this is the only, movable bone of the skull, and that's the mandible. It's actually U-shaped. We've actually taken a metallurgical section so that we can show you certain structures over here, and this mandible will actually bear what we call a body. So this is the body of the mandible. This is the body, and then it also have a ramus, and ramus means branch. So externally, okay, on the body, what we are going to find is that in the midline there will be a protuberance, okay, and that's what we call mental protuberance. Now, anytime you hear the word mental, it has to do with the mandible, so mental protuberance. And on either sides, okay, of the mental protuberance, we are going to have mental tubercles, and then there will be some openings on either side of this mental, protuberance, and that one will be called mental foramen. Please get to know that, mental foramen. Then on the body again, there will be alveolar processes where, of course, the teeth will dwell. Okay, that's the alveolar processes. And then on the ramus, now transiting from, of course, the body to the ramus, there will be an angle which you will traverse. Okay, and that is the angle. The angle represents the transition point from, of course, the body to the ramus. Now the ramus will bear two processes. It will bear a posterior process, and of course it will bear an anterior process. The anterior process is known as the coronoid process. Now, coronoid process, yes, it will move inferiorly to form, of course, the oblique line. So there will be an oblique line over here, this one that you see here. Then, of course, transiting from this coronoid process to the posterior process, which we call the condylar process, we are going to have a notch, and that notch is known as the mandibular notch over here. And then, of course, if I'm at the condylar process or the condyloid process, the condylar process will bear a head, and this is the head which is going to fit into what we call the mandibular fossa of what we call the temporal bone. You look at that. Okay, so this is the condyloid process, and it also bear a neck. Okay, so that is what I want you to look at over here. But if you look at the ramus, okay, internally, what happens is that there's a tangli process over there which we call lingula. Okay, that's the lingula, and the lingula is more or less like partially covering this opening, which you call the mandibular foramen. Mandibular foramen. Okay, mandibular foramen. Now internally on the body, okay, emerging from a lingula, okay, inferiorly, okay, anteroinferiorly, then what happens is that we have this line over here, which you call it mylohyoid line. Mylohyoid line. Now this mylohyoid line, of course, in the middle living, it will provide attachment to, of course, the mylohyoid muscle, and then above this mylohyoid line, anteriorly, we are going to have this sublingual fossa, so that the sublingual gland will dwell here, and below this mylohyoid line will be the submandibular fossa, so that, of course, the submandibular gland will dwell here. Actually, the superficial portion of the submandibular gland will dwell here. So that is, what I want you to know over here. Okay, so there are other things which you look at. You can have the retromolar fossa, of course, that's behind, okay, the molar tooth. Okay, that's retro means behind, retromolar fossa. Then that's the retromolar triangle. Okay, so that they are those things, and there's also a shallow groove where, of course, the lingual nerve will be running. Okay, so over there. So I'm trying to show you, it is not once you are talking about articulation of the condyle process, the head going to articulate so that we form the temporal mandibular joint. It is not the submandibular fossa, but it is that fossa we are going to call the mandibular fossa over there. Okay, so there will be an articular disc also helping in that regard. So remember that we saw that the submandibular fossa was actually in the mandible itself. Okay, was actually in the mandible itself. So this has been a very good revision exercise for us. I hope you find it helpful. If you've not subscribed to this channel, please do so that you get prompted every time the new video is uploaded. Share it to your friends so that they can also have a feel of it. Have a good night, and may God richly bless you.